Hi, I'm Candi Redel, and I'm going to give a speech on mammograms today. First, let me introduce the audience.
Hi, I'm Sailor Redel, and I'm going to be filming this, and now I'm going to show you the audience.
Okay, let's begin. The American Cancer Society's most recent estimates for breast cancer in the United States for women in the year 2012 is alarming. There's over 200,000 new cases of invasive breast cancer in women, and there's over 39,000 deaths from breast cancer in women alone. Breast cancer is the most common cancer among women in the United States, only second to skin cancer, and is the second leading cause of death in women. The chance of a woman having invasive breast cancer is high. The chance of me getting diagnosed with invasive breast cancer in my lifetime is 1 in 8. The chance of me dying from that breast cancer is 1 in 36. Breast cancer death rates have been going down. That's the good news. This is the result of early detection and better treatments. So how is breast cancer found early? By self-breast exams and mammograms. Many doctors feel the test for finding breast cancer early saves thousands and thousands of lives each year, but others disagree. Today I will tell you what a mammogram is exactly and the pros and cons of receiving one. What is a mammogram? A mammogram is an X-ray of the breast. One type of mammogram is a screening mammogram. The word screening refers to tests and exams to find a disease like cancer in people who do not have any symptoms. The goal is to find the breast cancer early before any symptoms are noticed. The earlier the breast cancer is found, the better the treatment usually works. Another type of mammogram is a diagnostic mammogram. This is used when symptoms and signs of breast cancer are already present. Things like lumps, skin color change, and nipple discharge. A diagnostic mammogram can also be used when a screening mammogram shows up abnormal. So what happens when a mammogram is, what do you do when you have a mammogram? When you arrive, first you will undress from the waist. You will wrap and cover yourself, and a technician, typically a woman, will position your breast for the test. The breast is placed between two plates that will flatten and spread your tissue. The pressure only lasts for a few minutes, and it is necessary in order to get an accurate picture of your breast tissue. You usually get your results within 30 days or sooner. Being called back to have more pictures taken does not mean you have cancer. 9 out of 10 women who are called back for pictures are not found to have any cancer. And in fact, only 2 to 4 of every 1,000 mammograms leads to an actual diagnosis of cancer. So is this why some women choose to not get breast cancer? Let's look at some of the cons of receiving a mammogram. How is it possible that finding cancer early isn't always better? That's what some may wonder. But one way to look at it is to think of our 4 different categories of breast cancer found during screening tests. First, there are the slow-growing cancers. That would be found and successfully treated with or without any screening. Then there are the aggressive cancers, the so-called bad cancers. These are deadly whether they are found early with screening mammograms or late with lumps and other symptoms. Both of these types of cancers, mammograms do not benefit. Then there are the harmless cancers that would never have mounted to anything but are still treated once they show up as dots on the mammograms. Women with these cancers are subject to overdiagnosis, meaning they are treated unnecessarily and harmed by screening. These women will have either part of their breast or their whole breast removed, and they will often receive radiation and chemotherapy. Many healthy women will experience a false alarm, the psychological strain and distress until one knows whether or not it is cancer, and even afterwards may be very severe. Finally, there is a fraction of cancers that although they are deadly, when they are found at just the right moment, they can have their courses changed by treatment. These are typically the only women that the cancers are helped with mammograms. So are there other benefits of mammograms? For the past several years, experts have debated the effectiveness of mammogram x-rays and what age women should first get them. According to the American Cancer Society research, It shows that this type of screening is one of the most reliable tools that doctors have right now for diagnosing breast cancer. A 2003 study of more than 200,000 women found that death rate from breast cancers dropped 44% from 1978 to 1998 after mammogram programs were implemented. Currently, the Mayo Clinic recommends an annual screening mammogram beginning at the age of 40. This coincides with the American Cancer Society's recommendations also. There also is a large study that was done in Sweden with over 1 million women in their 40s who received screening mammograms. They showed a decrease in deaths by 29%. And according to the U.S. Preventative Task Force, women who have screening mammograms die of breast cancer less frequently than do the women who don't get mammograms. Many advocates of mammograms look at these facts as reasons why to get a mammogram. But the screening mammogram is not a perfect exam, but it is the best available tool to detect cancer early, and what can lead to better options and possibly less aggressive treatments. Hopefully you have learned today what a mammogram is and a few of the pros and cons of receiving a mammogram. Ultimately, the decision is yours. If you're concerned about or thinking about getting a mammogram, talk to your doctor and learn what's right for you based on your individual risk. It's important that the two of you work together to develop a specific screening plan for you. Thank you.